1. What is the primary goal of motivational interviewing in addiction counseling? A. To enforce abstinence through confrontation. B. To provide strict behavioral feedback. C. To help clients resolve ambivalence about change. D. To identify client relapse patterns. 2. Which of the following best describes tolerance? A. Experiencing intense withdrawal symptoms. B. Needing more of a substance to achieve the same effect. C. Complete abstinence from substance use. D. Rapid detoxification from opioids. 3. What is the main function of the DSM-5 in addiction counseling? A. It prescribes treatment plans. B. It provides a billing structure. C. It offers a framework for diagnosing substance use disorders. D. It evaluates counselor performance. 4. What is a major risk of benzodiazepine withdrawal? A. Increased appetite. B. Euphoria. C. Seizures. D. Excessive sedation. 5. Which neurotransmitter is most commonly associated with the reward pathway involved in substance abuse? A. Serotonin. B. Dopamine. C. GABA. D. Acetylcholine. 6. In the trans-theoretical model of change, which stage involves clients planning to take action in the immediate future? A. Contemplation. B. Preparation. C. Maintenance. D. Pre-contemplation. 7. What is a key ethical obligation when working with clients in addiction counseling? A. Ignoring client confidentiality when family is involved. B. Providing legal advice. C. Maintaining professional boundaries. D. Treating only court-mandated clients. 8. Which of the following is considered a depressant? A. Cocaine. B. LSD. C. Alcohol. D. Methamphetamine. 9. Which treatment modality emphasizes peer support in a 12-step approach? A. Cognitive behavioral therapy CBT. B. Dialectical behavior therapy DBT. C. Narcotics Anonymous. D. Motivational enhancement therapy. 10. Which term refers to the co-occurrence of substance use and mental health disorders? A. Dual diagnosis. B. Cross-tolerance. C. Polydrug use. D. Acute withdrawal. 11. A client reports drinking again after 3 months of sobriety. This is best described as A. Withdrawal. B. Relapse. C. Tolerance. D. Abstinence violation. 12. What is the focus of harm reduction strategies? A. Punishment for relapse. B. Complete abstinence only. C. Minimizing negative consequences of use. D. Prolonging treatment. 13. What does the acronym ASAM stand for? A. Association of Substance Abuse Managers. B. American Society of Addiction Medicine. C. Addiction Support and Assessment Manual. D. Alcohol and Substance Abuse Model. 14. What is a common characteristic of codependency? A. Emotional detachment. B. Enabling behaviors. C. Refusal to engage in relationships. D. Substance use. 15. Which of the following medications is used in opioid dependence treatment? A. Diazepam. B. Disulfiram. C. Naltrexone. D. Sertraline. 16. What is the primary purpose of a biopsychosocial assessment? A. To diagnose medical conditions only. B. To determine client insurance eligibility. C. To evaluate biological, psychological, and social factors. D. To finalize discharge. 17. What therapeutic technique focuses on identifying and changing maladaptive thought patterns? A. Behavioral activation. B. Cognitive behavioral therapy (CBT). C. Reality therapy. D. Existential therapy. 18. Which population is most at risk for fetal alcohol spectrum disorders (FASD? A. Adolescents using cannabis. B. Infants born to mothers who drink during pregnancy. C. Teen males using stimulants. D. Children of recovering alcoholics. 19. When can a counselor disclose confidential client information without consent? A. To colleagues for supervision. B. If the client threatens to harm themselves or others. C. At the request of a friend. D. If a family member asks. 20. Which document outlines professional ethical standards for addiction counselors? A. DSM-5. B. NAEDAC Code of Ethics. C. HIPAA Policy. D. Federal Register. 21. What is an example of a SMART goal in a treatment plan? A. I want to feel better. B. I'll reduce drinking by attending 3 AA meetings weekly. C. I hope to stop using someday. D. I will change when I'm ready. 22. What is a common defense mechanism in clients with substance use disorders? A. Altruism. B. Repression. C. Denial. D. Sublimation. 23. The process of helping a client recognize a substance use problem through structured conversation is called A. Detox. B. Screening. C. Intervention. D. Evaluation. 24. What is the focus of client-centered therapy? A. Challenging irrational beliefs. B. Confrontation. C. Unconditional positive regard and empathy. D. Behavior tracking. 25. Which of the following is an example of cultural competence? A. Treating all clients the same. B. Avoiding discussions of race or religion. C. Respecting and incorporating a client's cultural background into treatment. D. Only using English during sessions. Certified Addiction Counselor NAEDAC NCAC. The Certified Addiction Counselor NAEDAC NCAC test is a nationally recognized certification exam administered by the National Association for Alcoholism and Drug Abuse Counselors NAEDAC. It assesses the knowledge, skills, and competencies required for effective addiction counseling, including areas such as counseling techniques, case management, pharmacology, professional ethics, and co-occurring disorders. The CAC and CAC2 certifications serve as benchmarks of professional excellence, helping counselors demonstrate proficiency in addiction treatment and affirming their commitment to ethical and evidence-based practices. Passing the NCAC exam is often a requirement for licensure or employment in many clinical and public health settings across the United States. Here are the top 5 beneficial uses of the sample exam. 1. Professional credentialing. The NCAC certification validates a counselor's competence in addiction treatment, enhancing credibility and demonstrating mastery of essential skills and ethical standards in substance use disorder counseling. 2. Career advancement. Holding the NCAC credential increases eligibility for a wider range of job opportunities, promotions, and higher salaries in clinical, governmental, and nonprofit settings. 3. State licensure compliance. In many states, the NCAC exam meets or contributes toward requirements for state licensure or certification, making it a key step for practicing legally and independently. 4. Client trust and outcomes. Certification reassures clients and families that they are receiving care from a qualified professional, contributing to better therapeutic relationships and improved recovery outcomes. 5. Professional development. Preparing for and maintaining the NCAC certification encourages ongoing education and adherence to evolving best practices in addiction counseling.